Tuberculosis may affect any part of the body, but the commonest is the lung, that's pulmonary tuberculosis. Other sites affected include the spine, bone and joints, brain, urinary tracts, abdomen, and lymph nodes. Pulmonary TB patients who have acid-fast bacilli in their sputum, that's bacteriologically positive TB, are most infectious and spread the disease through airborne droplets when they cough, spit, or sneeze. Drinking unpasteurized milk may cause bovine TB, which manifests as abdominal TB. Persons with lowered resistance to infections such as HIV, AIDS, and diabetes are especially at risk of developing TB. But such individuals tend not to have the typical symptoms and signs of TB, and they may have features such as fever, weight loss, and diarrhea, which could also be attributed to the condition. In children with severe malnutrition who show poor response to dietary treatment, TB must be considered and excluded. The causes are Mycobacterium tuberculosis, Mycobacterium bovis, that's bovine TB, and Mycobacterium africanus 1 and 2, and Mycobacterium microti, Mycobacterium kansasi, and Mycobacterium malmonsi. So Mycobacterium malmonsi, these are rare causes. The symptoms are for adults, cough even for 2 weeks or more, chest pains, weight loss, loss of appetite, blood-stained sputum, fever, drenching night sweat. For children, all adult symptoms and the following I'm going to mention: malnourished and chronically ill-looking, as cachexia, persistent low-grade fever lasting 2 to 3 weeks or more, failure to thrive, fatigue, malaise, poor appetite, back pain, or lower limb weakness, irritability, vomiting and impaired consciousness due to hepatitis B, due to TB meningitis rather. The signs that are usually elicited are signs of malnutrition, cachexia, pallor, signs of pneumonia or pleural effusion, lymphadenopathy, neck stiffness, altered level of consciousness in TB meningitis, spinal tenderness, gibbous, paraplegia or paresis in Pott's disease, and signs of extrapulmonary disease. Investigations are sputum smear, microscopy, chest x-ray, Mantoux test, gene expert MTB or RIF, and line probe assay, mycobacterial culture, full blood count, ESR, liver function test for monitoring medication side effects, as well as HIV screening. The main treatment objectives are to cure the disease, to prevent further transmission, to prevent the development of drug resistance, to manage drug side effects, to offer psychosocial support, to investigate close contacts. As where a child is affected, you always check adult contacts with productive cough. Non-pharmacological treatments include counseling, encourage good nutrition. Some food supplementation is provided by National TB Program. Encourage adequate rest. You admit severely ill patients. You assign a treatment supporter. Pharmacological treatment: for the purposes of TB management, you consider the following definitions. So adults, all persons aged 15 years and above. Children, all persons aged below 15 years. New patients, all persons who have never had TB treatment or have taken TB treatment for less than 1 month. And previously treated patients, that's all patients who have previously received TB treatment for 1 month or more. Refer to the TB client card, that's TB01, for guidance on formulations and dosing by weight. So let's look at the standard treatment. For first line treatment, we look at the TB treatment category, TB patient type, the treatment regimen, and the comments. So for adults, for new patients, CAT1 and plus 3, as all cases, all new cases, including new smear positive pulmonary tuberculosis, new smear negative pulmonary tuberculosis, concomitant HIV disease, extrapulmonary TB. The initial phase, 2 months of HRZE is called to, you give 56 doses of HRZE. Continuation phase, that's 4 months of HR. We gave 112 doses of HR. So the treatment is once daily, and in HIV disease, the treatment can be extended to 8 months. Let's look at another category. So previously treated patients, that's CAT2 category 2. Patient type, previously treated sputum smear positive pulmonary tuberculosis. There is a relapse, treatment after interruption or treatment failure. The treatment regimen, you use 2 months of that's streptomycin, plus 3 months of HRZE, H for isoniazid, R for rifampicin, P Z for pyrazinamide, E for ethambutol. So you give the HRZE 56 doses of S, as streptomycin, and 84 doses of HRZE. Then 5 months of HRE, as the isoniazid, rifampicin, and ethambutol. Thus the total doses is 140 doses of HRE. So request drug susceptibility testing before starting treatment, and treatment is once daily. So let's look at another category. So for TB meningitis and osteoarticular TB, for TB patient type, that's for all cases, 2 months of HRZE is equal to 56 doses of HRZE, and 10 months of HR is equal to 280 doses of HR. Treatment is once daily. For children, new patients, all new cases, including new smear positive pulmonary tuberculosis, new smear negative pulmonary tuberculosis, and concomitant HIV disease, and extrapulmonary TB, the 2 months of HRZE is equal to 56 doses of HRZE, and 4 months of HR is equal to 112 doses of HR. And treatment is once daily. In HIV disease, treatment can be extended to 8 months. The previously treated patients, as for children, previously treated sputum smear positive pulmonary tuberculosis, that's relapse, treatment after interruption, and treatment failure. The initial phase was 2 months of S with streptomycin plus 3 months of HRZE, which got 56 doses of S and 84 doses of HRZE. For 5 months of HRE, it's got 240 doses of HRE. Request DST before starting treatment, and treatment is once daily. For TB, meningitis, and articular TB, for all cases, the initial phase, 2, that's twice HRZE is got 56 doses of HRZE, and 10 times HR is go to 280 doses of HR, and treatment is daily. So the treatment month is 28 days, and all patients taking isoniazid as age should take 25 milligrams of pyridoxine as vitamin B6 to prevent peripheral neuropathy, and the dose of pyridoxine should be doubled in HIV patients. Indications for steroid use in childhood TB include endobronchial TB, large pleural effusions, pericardial effusion, and TB meningitis. The duration of steroid use should not exceed 1 month. So all children under 5 years and all HIV positive children who are contacts of a TB patient should be given prophylactic isoniazid at a dose of 10 milligrams per kilogram body weight for at least 6 months. Dosing for TB medicines. So anti-TB drug and recommended daily dose with a maximum dose for both adults and children. So isoniazid, abbreviated as H, the adult dosing is 4 to 6 milligrams per kilogram with a maximum dose of 375 milligrams. The children dosing is 10 to 15 milligrams per kilogram with a maximum dosage of 300 milligrams. Rifampicin, abbreviated as R, adult dosing is 8 to 12 milligrams per kilogram daily with a maximum dosage of 740 milligrams. And children dosing 10 to 20 milligrams per kilogram, 600 milligrams max. And also pyrazinamide, abbreviated as Z or Z, adults give 20 to 30 milligrams per kilogram with a maximum of 2000 milligrams. In children, 30 to 40 milligrams per kilogram with a maximum of 2000 milligrams. Ethambutol, as abbreviated as E, you give 15 to 20 milligrams per kilogram with a maximum dosage of 1375 milligrams. In children, 15 to 25 milligrams per kilogram with a maximum dosage of 1200 milligrams. Also streptomycin, abbreviated as S, adults 12 to 18 milligrams per kilogram, a maximum dosage of 1000 milligrams. In children, 20 to 40 milligrams per kilogram with a maximum dosage of 1000 milligrams. Adjunctive treatment. So you give pyridoxine, that's vitamin B6 oral, in adults 50 to 100 milligrams daily for 3 to 8 months. In children, 25 to 50 milligrams daily for 8 months. And also prednisolone oral in case of TB meningitis and TB pericarditis. In adults, 40 to 60 milligrams daily, 2 to 4 weeks, and then you taper off on improvement over 2 to 4 weeks and you discontinue. Children, 1 to 2 milligrams per kilogram daily for 2 to 4 weeks, and then you taper off on improvement over 2 to 4 weeks and you discontinue. The treatment in special situations. So for chronic kidney disease, as new cases in adults and children owing to a high risk of uveitis. He gave the following: so intensive phase HRZ for 2 months. So that's the isoniazid, rifampicin, and pyrazinamide for 2 months. In for the continuation phase, HR for 4 months. In pregnancy and breastfeeding, you give standard treatment and do not use streptomycin, so toxic for to the fetus. Prevention of drug resistance. So to prevent the development of drug resistance to rifampicin, it's recommended that isoniazid and rifampicin combination tablets is used instead. Prescribing rifampicin alone is not approved and must be discouraged. During treatment, the patient must swallow all the oral drugs, preferably on an empty stomach under direct observation. The patient needs to be under close supervision by a health worker or a responsible person or a member of the community with support from health staff during the full duration of treatment. So monitoring. During the course of the treatment, all smear positive pulmonary TB patients should have repeat sputum smears examined as after 2 or 3 months if treatment, and at 5 months and at the end of the treatment. If results is smear positive, a request for mycobacterial culture and drug sensitivity testing.